Posterior urethral valves is a rare condition that affects baby boys. They're born with a blockage in the urethra, the tube coming out of the bladder. This causes damage to the structure behind the blockage. In the normal baby, the bladder, ureter, and kidneys develop at the same time. But in boys with valves, early on in pregnancy, an extra flap of tissue blocks the urethra. This blockage backs urine up, dilating the ureters. One or both kidneys may not form or function properly. The bladder muscle works hard to push through the obstruction, so it becomes thick-walled and irregular. The blockage causes urine to dribble out with a weak stream. This may be the first thing that is noticed with a baby with valves. In the womb, the blockage means the baby wheezes less. The amniotic fluid surrounding the baby is mainly fetal urine. If there's less urine, there can be less amniotic fluid. Baby lungs need plenty of amniotic fluid to develop properly, so in severe cases the baby may have difficulties in breathing after birth. After birth, urine backs up. It's important to relieve the blockage, otherwise waste products build up. At first, this is by using a small catheter tube into the bladder, and later on using surgery to remove this excess flap of tissue. So what are the long-term problems of having valves after the valves have been unblocked? Well, it very much depends on how much damage occurred before the baby was born. Some children have no problems at all, with kidneys and the ureter tubes being made normally. Others will always have dilated kidneys or tubes, but they work normally. Having dilated tubes and thickened bladders make the baby prone to urine infections, as there's always stagnant urine in the system. Dilated kidneys is called hydronephrosis, which means water in the kidneys, and dilated ureters is called hydroureters. Fecal ureteric reflux means backflow of urine back to the kidney when the baby wheezes. This is quite common with valves and again increases the chance of urine infections. Lastly, sometimes the kidneys can be made quite abnormal and do not function properly, especially if both kidneys are affected. This is called renal dysplasia. Blood tests will determine how much function there is to clean the baby's blood, and an eye needs to be kept on the kidney function as the baby grows. All babies with valves are more prone to urine infection. This has been a brief overview of posterior urethral valves. All children are different, so please speak to the kidney and urology team for specific details.